35-year-old obese man presents to the office complaining of a chronic heartburn and nausea for the past 6 months. These symptoms are relieved when he takes 20 mg of omeprazole twice a day. The patient was prompted to come to the doctor when he recently experienced difficulty breathing and shortness of breath, symptoms which he believes underlies a serious health condition. The patient has no cardiac history but is concerned because his father recently died of a heart attack. Imaging of the patient's chest and abdomen would most likely reveal which of the following. This patient does have a diaphragmatic hernia, okay, but it's important to know what sort of hernia. So option A is protrusion of fundus of the stomach through the diaphragm into the thoracic cavity. They're talking about a paraesophageal diaphragmatic hernia, which is the diagnosis in this case, whereas option D, which is an hourglass stomach, talks about a sliding hiatal hernia. Okay, so one is paraesophageal hiatal hernia, this one is sliding hiatal hernia. The main thing to differentiate between the two is that in the case of paraesophageal, the patient will have pulmonary involvement, which is what is seen in this case. This patient has difficulty breathing and shortness of breath. In the case of sliding hiatal hernia, there will not be pulmonary involvement. So you can go with that option if the patient was not having any symptoms of breathlessness or just any sort of symptoms that involve the respiratory system as well. Okay. Lung hypoplasia due to a defect in the diaphragm. This is seen most commonly in the case of congenital diaphragmatic hernia. Okay, not in the case of an adult because the lungs are fully developed. It has nothing to do with that. So you can rule out option B. Widened mediastinum with evidence of esophageal rupture. Here they're talking about Boer-Haave syndrome. Here they have not mentioned anything about the patient having violent retching, or there's no mention of hematemesis. So that itself, you can rule out Boer-Haave syndrome. Moreover, there's nothing mentioned about alcoholism, okay, or bulimia. So you can just rule it out. And the last one is cardiomegaly with pulmonary effusion, usually pointing towards the diagnosis of congestive cardiac failure. None of the other features really point towards CCR. The patient, in the case of heart failure, would present with some sort of edema, or they have orthopnea, or just the rest of the typical features. Okay, patient here has nothing else. Moreover, it says patient has no cardiac history. Okay, though he has family history of heart attack, but it's okay. You can just rule it out. The features don't line up with the case of a congestive cardiac failure.
Thanks for watching. Please give a thumbs up and subscribe for more.